Hi, I'm Dr. Shilpa. Today I will be discussing about the pregnancy where there is a previous cesarean section. So if the woman undergoes cesarean in the first pregnancy and she comes back to us in the subsequent pregnancy, it could be a second pregnancy, third pregnancy, how different is it than a pregnancy which has had a normal delivery before? So this, I think, is a very common situation where previous LSCS, as we call it, or a previous cesarean, where we see it almost in about 25 to 30% of cases in terms of like when they come for a second or third pregnancy. So how is it different is like one, the pregnancy this time can happen in the previous cesarean scar. So the scar on the uterus can sometimes start developing the pregnancy in that site, and this can lead to a special situation called a scar pregnancy, which is quite dangerous, and this cannot continue, and this may be needed to terminate. And also the termination may not happen just with the tablets or the injection. Sometimes surgical treatment, that is surgically, laparoscopically, the excision of the scar pregnancy may be required. So the other things which can happen in a previous cesarean is that only during the time of delivery we will have to take a decision whether we can try for a vaginal birth after cesarean, which is called as a VBAC, or whether we can go ahead and do a elective or a planned cesarean in all cases. So in this special situation, where we want to try for the vaginal birth after cesarean, there are a couple of things which are important. One is the previous indication as to why a cesarean was done. So if the previous indication was something like the disproportionate between the baby's head and the mother's pelvis, or a very small pelvis, then ideally this time also the woman should undergo a cesarean section. So these are called as recurrent indications, where the indications keep happening the second time round. Then they will have to go for a planned cesarean for the safety of the both mother and the child. So what is the safety? Why are we talking about safety here? Is the previous cesarean where we have stitched up. So just above that area and below that area, the scar will be quite weak. So when there is distension of the uterus because of the pregnancy, sometimes this scar can get weakened and this can rupture. So that time we may lose the baby. And also there may be pain during the pregnancy in the third trimester because of the scar becoming weak, and it may slightly open up. So apart from this, apart from the mode of delivery, that is planning whether it is going to be a vaginal delivery or a cesarean, so there could be an additional need for instrumental delivery if we are going ahead with the vaginal delivery. So that is normal delivery after cesarean, which is born through the common birth passage. So here again, couple of things are extremely important, where we have to select the cases which have the utmost safety for both the mother and the fetus, where the baby's weight is average, mother's pelvis is good, the cervix, that is, it is slightly open, and the mother has got pains spontaneously, that is, it is not induced, and also she doesn't have any other risk factors like blood pressure, diabetes, or obesity, or we can immediately do the cesarean within a span of like say 20 to 30 minutes. The setup should be such that like emergency services by the anesthetist, by the pediatrician, and by the obstetrician should always be there. Also all this can again, like if at all, if during the process of the labor, if at all, if there is any emergency kind of a situation where the fetal heart rate drops down, or if the baby's head doesn't descend down, then we'll have to go in for an emergency C-section. So all this has to be documented, should be discussed with your doctor in detail, and then the decision has to be a combined one. So the success of this vaginal birth after cesarean section is about 10 to 15%, and 85% of the times they may end up in cesarean again. And also the drugs that we use to augment or to increase the labor pains or to increase the speed of the delivery may not be safe during the VBAC. And post delivery, that is like after using the instrument and delivering the baby, that is the forceps or the vacuum, and post delivery there may be tears and there may be excessive bleeding which we may have to tackle, or the scar might have given away and we may have to check whether the scar is intact or whether it is ruptured. So post delivery we may have to do that. So during planned cesarean, again we can expect some additions, we can expect a difficult cesarean, and if needed family planning also can be done at the same time. So all these are the commonest of the problems that we come across during a case of a previous cesarean, but this is going to be more and more common now because many women opt for an elective cesarean even in the first pregnancy. So it is always better as to how we reduce the risk or how we reduce the rate of cesarean is by reducing the rate of doing a primary cesarean. So in the first pregnancy we have to give it a maximum try for normal delivery, and subsequently the chance of normal delivery will be much better. And also the woman should be encouraged to be more physically active and to be more open and more positive about going through the process of labor, and the whole family should have enough patience and trust on the doctor that they are consulting to do the normal delivery. So above all this, the patient and the family should have the patience and also the trust on the doctor to successfully deliver vaginally after a cesarean section. So if there are more doubts, you can write on the comment box. I will try to answer them. Thank you.